All right, so I think I met a few of you last night. My name is Victoria McCullough. I work in the Office of Public Engagement. I can't tell you how excited we are to have you here. This has been sort of one of the more long-term, we planned this about 6 months ago, so this has been a long time in the making, so we're excited you guys are finally here. And so a few things, I just want to run through logistics. I think you guys, most of you have already figured this out. So a couple things, so if you exit here, there are a couple of bathrooms on each side, so if you walk through either of those double doors as you walk out of Southport Auditorium, this is where we are now. If you move to go to the right, there is a coffee, like a Ike's Cafe is there. You guys need to step out, as well as restrooms for both men and women. So that's very important, so I want to get that out of the way. So you guys can get up and move around if you need to during the session. So I want to get that out of the way and then talk a little bit, just really briefly, about why we do this series. So this is definitely the first time we've ever had a group of this size and really the footprint of Rotary. You guys are just such a powerful and effective organization. So it's why we really thought it would be great to bring you here to not only hear sort of what you're hearing as you're volunteering and you're working on projects, what your challenges are, how the administration and the government can maybe be more helpful and supportive. But so we really wanted to take that opportunity to learn from you and then hopefully tell you a little bit about what we're doing. And then this afternoon, we'll actually, we're going to be spotlighting and sort of honoring a lot of the good work that you guys are doing by honoring 10 champions of change from Rotary. So that'll be the run of the day. And the last thing, a couple of other small like housekeeping notes. We're going to end promptly at noon for lunch, and then we're going to ask, it'll be a quick lunch, and I'll come up and explain all the logistics, but we'll need everyone for this second session to be back here by 1 p.m. So it's really important for that to happen. Let's see, I think I covered everything. So I want to actually turn it over to you guys and introduce Mr. John Huco, your General Secretary.
Thank you very much, Victoria, and good morning, everyone. Of course, we're all delighted and honored to be here today to show Rotary's enthusiasm and support for community activism and to show what a group of dedicated professionals and community leaders in the United States and beyond can accomplish. As you know, Rotary members are business and professional leaders who volunteer their expertise, compassion, and power to improve communities at home and abroad. And Rotary's worldwide network of 34,000 clubs hosts 1.2 million inspired individuals who translate their passions into social causes and change lives and improve communities. And as community leaders, volunteers, and citizen activists, we're here today to learn. And as professionals, we understand the importance of garnering pertinent news and information. And this is particularly important as we learn how Rotary can better enhance efforts toward health, youth, and education, economic and community development, water and sanitation, and other humanitarian efforts. We also look forward to the opportunity for dialogue with White House and federal agency officials. We're here to learn, and we're here to share. And we're pleased to share that Rotary's track record of success can be demonstrated by the millions of people who've achieved and sustained a better quality of life. We will see some of that today through the efforts of our champions of change. And as you know, of course, Rotary's top goal is to eradicate polio worldwide. And in collaboration with the World Health Organization, UNICEF, the Bill and Melinda Gates Foundation, and national governments, Rotary, we are close to eliminating the second human disease in history after smallpox, with a 99% reduction in polio cases worldwide since 1985. And here this morning to tell us more about Rotary's success with its public-private partnership is someone who has experienced Rotary's polio success firsthand. Rotary International's 2011-2012 President Kalyan Banerjee has been instrumental in polio eradication efforts in India and beyond. Since joining in 1972 the Rotary Club of Vapi, Gujarat, in his native India, Kalyan has been instrumental in moving his country and others toward a polio-free world. President Banerjee has served on numerous polio task forces, including Rotary's Southeast Asia Polio Task Force and the International Polio Plus Committee. He's also participated in key Rotary efforts toward poverty and hunger alleviation and Rotary's Reach Out to Africa Committee. A chemical engineer by training, President Banerjee is chair of United Phosphorus Bangladesh and a director of United Phosphorus Limited, which is one of the largest manufacturers of agrochemicals in India, and he's also director of Unifos Agro Industries Ltd. President Banerjee is married to Binota, a social worker, and they have 2 children and 4 grandchildren. So please extend a warm welcome to 2011-2012 Rotary International President Kalyan Banerjee. President Banerjee.
Thank you. Distinguished guests and my brothers and sisters in Rotary, good morning. And as we say in India, namaskar. Well, it is really a pleasure to be here today as we begin the Rotary Day at the White House. And I'm glad to see all of you here this morning. And it is an honor for me to be representing Rotary International, which is, as I hope all of you know, the world's oldest humanitarian organized service organization, as well as one of the largest. It's always a little bit of a challenge to speak to an audience like the one we have this morning, where we have both committed Rotarians and those who are not yet members of Rotary together in the same group. It's even more of a challenge to know that this speech is being streamed live on the White House website, where it is being seen by people who may know nothing about Rotary at all. But I'll do my best, and I hope that the Rotarians in the room will bear with me as I start out with some Rotary basics. Well, for those of you who are not Rotary members, I'll say that Rotary is an international organization composed of 34,000 Rotary clubs, whose volunteer members currently number, as you just heard, just over 1.24 million. Rotary clubs can be found in more than 200 countries and geographical regions throughout the world, and the Rotarians in them are involved in all kinds of service. Now, what does this mean, this word service? Well, Rotary service on the club level can be anything from a job training program in a high school to equipping a rural health clinic or supplying a community with clean water. Some of those projects are run by a single club, some by many clubs together, and some of them with the financial backing of our Rotary Foundation. These projects are what you would call the bread and the butter of Rotary. They are what Rotary members talk about in their weekly club meetings, and they are how each club makes an impact on their community. But on the global level, there is one undertaking that every single Rotary club in the world is a part of, and that is the Global Polio Eradication Initiative. Now, polio here in the United States has not been a major public health concern since the 1950s. But for me, as an Indian, I see polio a little differently. And so do the people in Afghanistan, Nigeria, and Pakistan, where polio is still endemic, and the countries in Asian Africa, where polio has reappeared after being eradicated. And as many of you will remember, that it wasn't that long ago that polio struck more than 1,000 children a day in countries across Asia and Africa and South America. In 1988, there were 350,000 cases of polio worldwide and more than 125 polio endemic countries. Last year, there were fewer than 700 cases in only 3 endemic countries. A year ago, I would have said 4 endemic countries, but just this past January, my own country, India, was taken off the endemic list, with no new cases of polio at all in over a year, down from hundreds of cases just a few years earlier there. So what happened? What happened was that in 1985, Rotarians took a look at what they had in Rotary and realized that they were capable of doing something much larger than what they were used to doing. We decided to aim high, and we decided that we were going to commit ourselves to doing whatever it would take to eradicate polio completely, just as smallpox was eradicated in the 1970s. It was ambitious then, and it is ambitious now. We knew it would not happen overnight, and it did not. But now, in 2012, we are very close to achieving this goal. And as significant as that milestone will be, perhaps equally significant is what else has been achieved along the way. To eradicate polio, we have needed the cooperation of countless individuals and organizations and governments, from the World Health Organization right down to the village elders, with every manner of official, school, government agencies, NGOs, and the media outlets in between. It's really been an incredible exercise in learning to do things in a new way, forging partnerships and agreements and understandings for which no model had ever existed, and bringing together people who had never worked together before, united in the vision of a polio-free world. Since 1985, Rotary members and volunteers have raised over $1 billion and volunteered countless hours of their time to help immunize more than 2 billion children in 122 countries. And I say help immunize because Rotary is not fighting this battle alone. Now we are part of a global eradication initiative involving WHO, the US Centers for Disease Control and Prevention, UNICEF, and the governments from all over the world. When the numbers are this large, and when we are not talking about hundreds of thousands or even millions of children, but 2 billion children opening their mouths for those drops of vaccine, it can be difficult to take the numbers in, really. But this is the kind of work that Rotary is capable of, because we have a unique and an incredibly effective model, one that is proving itself capable of achieving results that could not be achieved in any other way. What is so unique about Rotary? Well, the main thing is that we are both local and international. Every Rotary club is formed of members who live in the community they serve. And we are not religious, not political, not affiliated with any government. But we are able to work with all these structures at every level, just about anywhere in the world that you would care to name. Rotary is unique. As someone once said, it has the strength of a government and the tenderness of a parent. And sitting where we are today, I think this is a simile which is particularly effective and appropriate. And this is what makes Rotary so powerful, because when we made the decision as an organization to commit to polio eradication, we knew from the start that the real work would not be done in our headquarters in Evanston, Illinois. The real work, as always, is done by Rotarians, where they are, in the cities and the towns and the villages where the needs are. And this is how we have been able, through all these years, to find the obstacles to eradication and address them suitably, deal with them, indeed overcome them. We can go to the local authorities to immunize the children of a school and the state governments to organize a national immunization day at the same time. Because we have those local connections, because we have no other agendas, because we are most fundamentally a group of people who care. This is how we are able to gain entry where other individuals and other organizations sometimes cannot. Polio isn't gone yet, but it's clear that the end is in sight. And it's time to start thinking about what we are going to do with the lessons that we have learned through Polio Plus. We have learned that there are things that the governments cannot do alone, and that individuals and organizations can't do alone either, but we can do them all together. And the question that I ask you now, my brothers and sisters, as we begin this day, and that the question is that I want you to take home with you this evening when you leave is very simply, what else can we do if we decided to do it all together? Thank you. Have a wonderful day.
So I want to introduce one of our main bosses here at the White House, Mr. Jack Lew, our Chief of Staff.
Thank you. It's welcome to the White House. It's great to be with you this morning. It's particularly a pleasure to come and be with a group that's as committed to service as you all are. It's something that has been central to my career in government. I'm proud that one of the things that I was very much involved in the Clinton administration was helping to set up AmeriCorps and the Corporation for National Community Service. I served on the board there for a number of years. I've been on the board of service organizations in my community. And I've often said that one of the real sacrifices of public service is that one has to cut their ties to community service because you can't be on private boards while you're in a public position. So I look out and I'm a little jealous of all of you who are able to be in your communities doing work on the ground to make your communities and our country a better place. The President's commitment to service is deep. It's reflected in terms of domestic programs by his very active work to extend the AmeriCorps program, the corporation program in the Kennedy bill. In the international space, it's very much reflected in the work that he has done to have our development programs reach out across continents to show the hand of help that the American people offer when we go out and develop health and nutrition and other programs to make it possible for the step up to be available to people who are struggling around the world. You and your own communities understand that there's just nothing that's equivalent to being connected to people and helping them help themselves. And when I go into a school, I was on the board of City Year New York. When I go into a school and I see these kids come in and be role models in a community where it's just so desperately needed for there to be, the cool thing to be has to be to learn how to read and learn how to be a productive part of society. And that doesn't happen just through government programs. It does happen because we help support those programs. And one of the things that is, I think, very important is that as we go into a period of tightening fiscal belts, that we have tough choices to make. And I don't think we can treat investing in our communities as a discretionary decision. It's something that we have to do to build the social fabric that connects us to each other and our communities to one another. You know in your communities that it's not enough to just put public funding into things like AmeriCorps grants. It takes people on the ground who are connected to their communities. It takes private sector donations. It takes commitment of time. It takes the energy and the passion that all of you bring to the work that you do in your homes and communities. So I'm delighted to welcome you here to the White House. I know we have a few minutes for some questions and answers. And I will stop with those opening remarks and look forward to discussing the topics that are of interest to you. Please don't be shy. Way in the back.
Mr. Liu, on public education, we often as citizens of America hear our politicians saying they're going to make them global and second millennium prepared. And then later we wind up getting the bad news that budgets are being sliced. So my suggestion is that some jurisdictions don't have feeders of funds to public education and some do. For instance, some use real estate taxes, some use lottery money to feed their public education. How do you feel about that being a formula throughout the United States? Now, there are some that may...
Are you talking about domestic or international right now?
Domestic. From a public education standpoint, I figure that we start at ground zero and get the kids well read in their elementary school years. They become those good citizens that are paid to work in these nonprofit and community-related organizations and make the world a better place. But I just look back at that we're constantly, as parents, told that budgets are being cut. And what do you suggest we do as parents to get past that common note that the budgets are being cut?
So let me address it first from a federal perspective and then from a local perspective. And I don't think it's just about numbers of dollars. The focus has to be on spending the money well. And that's why it's been so important in this administration that we've had our Race to the Top initiative, where we've put out challenges for communities to improve their programs, improve their standards, and to make it a badge of honor as well as financially worthwhile to have that accomplishment. That program is having real results, and I think we have to stick to it. In our many billions of dollars of funding for education programs, that's $550 million of it. So it is important that we have large amounts of money that are there to help support school systems, both in terms of their basic elementary and secondary programs and in terms of their special education programs. But it's also important that we focus the money on reaching goals that really produce the outcomes that you're describing, which is well-educated students who are able to take their place in society in the next generation. I think the challenge in this economic decline, that there have been many challenges, but one is that there's been particular drag on state and local finance. We've seen state and local revenue tight, and we've seen layoffs, particularly in schools and fire departments and police departments. That's something that I think is a local issue as much as a federal issue. I don't think it's reasonable to expect that federal money will just step in and kind of fill all the gaps. There has to be the focus at the local level on setting priorities, and just as we have the benefit of advice here in Washington, I think local leaders need the benefit of advice on what the important priorities are in their communities. Some of that will correct itself as state and local tax bases improve, and we're seeing that already. We're seeing in some jurisdictions that revenue levels are getting back to pre-financial crisis, pre-recession levels. I guess one of the things that I worry about is that we might have plateaued down in terms of level of commitment to things like education. And I don't think that's acceptable. We can't have school systems that have growing needs and declining resources. And we can't just have that be a federal challenge. So I think we need to do our part. We need to maintain funding streams. We need to have standards. And there are also going to be tough trade-offs. We have to ask which programs work, which ones are effective, and kind of double down on the things that work. And that may mean making cuts in some other places. But I think it's as much of a state and local issue as it is a federal issue, because fundamentally state and local governments are the source of financing for education in the United States, with all the money that we put in at the federal level. Yeah.
My name is Kenny Barnes. My category is reduction of gun violence. I'm a member of the Rotary Club here in Washington, D.C. Perspective. I'm probably the only person you met or will know that I've met with the NRA, I've met with Reverend Sharpton, I've met with the NAACP, I've met with Noble. And I'm saying that there should be a new perspective on the way we address issues of gun violence, rather than looking at it as a Second Amendment issue. A right to bear arms, which is not the problem. The problem is what's causing gun violence. And I'm suggesting that there be a strategy now, instead of debating that. And I've talked to the NRA, I've talked to all these organizations, and they maybe would be willing to listen on that new strategy and look at ways, because death by gun violence is the #1 killer of African American males in the United States of America today. And there's not really no formal policy to deal with it.
There is a real challenge we have, both in terms of the availability and distribution of weapons, and also in the root problems that are giving rise to the use of weapons. And I think we've had some pretty painful reminders in recent months of how broad the challenge is. So clearly we have spoken to that as an administration, but we need, as a country, to keep working on it. Yeah.
Rotary and the Rotary Foundation has been focused very much on sustainability. I would suggest that government programs with a lot of government funding may need to take a look at that as well, because I'm not sure that government funding is necessarily a sustainable way to make projects work. Any comments on that?
Well, I think that it is certainly the case that as we as a government support things domestically and internationally, sustainability has to be something that we very much focus on. It doesn't solve a problem in the long term to have funding that reaches a level and then drops off the cliff, and a program is abandoned because the funding is no longer there. So the challenge is, how do you fund activities that are important so that you have a realistic notion of what the long-term funding path is, and a plan for what to do as things mature and graduate from funding, in the case of a grant program. I don't think there's a one-size-fits-all answer. I don't think that our national commitment will go away or should go away in a lot of areas. We're going to need to stay committed to things like education and health and research funding. On the other hand, we do need to worry about having models of, we were talking about education before, sustainable funding levels for local school systems. And part of that is having the kind of honest debate in our communities about what kinds of resources are required to produce the outcomes that we want. And I think that the economic situation that we have faced over the last 3 years has forced us to deal with getting the economy moving, and I think we've done a great job getting the economy moving. We're not out of the woods yet. We have daily reminders that we've got to stay focused on having this recovery become truly organic, but we're moving in the right direction. You look over the horizon, and it's quite clear that that government spending is going to need to be trimmed in a lot of areas. We have already made the decision to trim government spending on the kind of annual appropriations, the things that support things like education grants and the like. Frankly, one of the things that we need to do in order to have a sustainable, large frame fiscal approach is to have the kind of balanced, spending and revenue-based program which over 5 years, 10 years, and beyond provides the resources to meet the program that we as a country need. The debate over revenue in this country has been almost divorced for the last number of decades from what we need as a country. The questions have to be connected. We can't, I don't think, become a country that turns its back on sick people and old people and students who need to step up. On the other hand, we can't spend money that we don't have. And you go through the debate over this category of spending called discretionary spending. It's the easiest thing in the world to cut as a just aggregate number. Who wants to support anything you would call discretionary spending? We all know in our budgets that's the first thing that goes. Well, it's not really so discretionary. I mean, I don't think it's discretionary to have a child who enters kindergarten today graduate high school able to read and write and participate in society as a fully educated member of the workforce and society. Well, anyone who thinks that that's discretionary, I just disagree with them. So we maybe have to change the language. We have to be willing to have the burden shared fairly in terms of who pays the bills and how they're paid. We have to be willing to make cuts on things that are less important, and that's what we've been doing for the last several years. And we're going to have to deal with some of these long-term issues in entitlement programs, but we have to do them in a way that reflects the fact that the recipients have real needs. I don't think we want to become a society where if you're 85 years old and disabled, you don't have the ability to get long-term care. So you look at a program like Medicaid, that's where the cost drivers in Medicaid are. So if we're honest about what our needs are as a society, and we're honest about sharing the burden fairly, it's not a question of kind of who's good and who's bad. It's a question of, are we all in this together? And if we're all in this together, this is not that hard of a problem to solve. It's when it's one side or another that has to bear all the burden that it becomes so challenging. And I think that's what the president's been speaking to as he talks about everybody having a fair shot, everybody playing by the same rules, and everybody doing their fair share. It's kind of the essence of American common sense. I think I have time for maybe one more here in the back.
Yes, Rotary
I
clubs.
was actually pointing in the middle, so I'll take two
Sorry
more.
about that.
Go ahead.
Rotary clubs work largely within their own communities to help build the community. But we do have a huge problem with our infrastructure, and a recent article of Thomas Friedman talking about our infrastructure and the priorities and a view for what that is. Would you please comment on the administration's position on?
Well, our position on infrastructure is very clear, and we couldn't believe more strongly that we need to have the highways and the airports and the seaports. They put us in a position to do commerce and have transportation available that is, just tops in the world, not lagging behind. Again, that means we have to be willing to make choices. And it is quintessentially a public good to provide for things like highways that work and railroads and seaports and airports. There are needs to have a fair distribution of burden of paying for things that are of special value. So we have all kinds of fees built in. But fundamentally, it is a question of, are we willing to make the decisions? The Senate has been working on a highway bill. And it's a highway bill that would actually help move us in the right direction. It doesn't go as far as the president's proposal. The House has taken a different approach. They've said we need to cut back on how much we're able to do. And there's going to be a debate over the next few months about, do we do something that's as expansive as what the president's proposed, which is kind of on the scale of solving the problem, the best place to be? Do we do something that is somewhat smaller but still more aggressive than the current program? Or do we scale back from the current program? And we have to kind of have an approach that, again, says, what do we need as a country? And then you have the conversation of, how are you willing to pay for it? If it's all driven by how much can we cut from it, it's not going to give us the solution we need. On the other hand, we don't have infinite resources. So we're going to have to make hard choices, and we are going to have to pay for it. The Senate bill, for example, has pay-fors in it.
Good morning. Bonnie Thrower from District 7490 in northern New Jersey. I heard an impassioned speech by our Congressman Bill Pascrell about the cutting of food stamps last night. Many of our Rotarians and Interact kids do food drives. How can we as Rotarians step up our efforts to fill in some of these gaps that are created in the budget cuts?
I think there's a huge and important role for private philanthropy in filling gaps. But I think we also have to understand that that's all we have to have gaps that can be filled. You can't eliminate the kinds of levels of support that come, to provide for the basic nutritional needs of a low-income family through food stamps or SNAP, with just saying we'll just let the private sector deal with it. We know it happened when there was no public partnership in this. A lot of people fell through the cracks. On the other hand, government can't do everything. and the work you do in your community to make sure that the shelves of food pantries are stocked and that meal programs are staffed is critical. I don't think it's either or. It's both. And the challenge of advocating for things like SNAP is not always easy because there's a sense I'm working pretty hard to live within my budget. Why should somebody else have some kind of help? Well, the fact is we're a country that has helped people fall through the cracks of the safety net. And that's what the SNAP program does. It's what the Medicaid program does. We have to run those programs well. We have to make sure that people who are not eligible don't get benefits, that people do the right thing with their benefits, that in things like Medicaid, providers don't take advantage of the program. We have a huge responsibility of public stewardship. But I don't think we can say we should shift that whole burden to the private sector. We need to be good partners, and we need to know that you're out there doing your work, and I think you need to know that we're here doing our job. I think I'm going to have to cut it there. I've already gone beyond the time that was allotted to me on the program, and I've got a meeting I'm late for. So thank you very much for being here and for the work that you do.
Next up, and then after Dr., we're going to have Dr. Michael Liu come up from U.S. Health and Human Services, and then right after Michael, we'll take that coffee break. So I want to preface by saying Dr. Liu just revealed to me that he actually just moved here from UCLA. He's been here in this job for 3 months, so you should be sure to ask him plenty of hard questions. All right, Dr. Liu.
Good morning. I'm delighted to be here and very honored to be invited by the White House to brief you on maternal and child health this morning. And I'm especially honored because you're all my heroes. The work that Rotary does right here at home and all over the world. In fact, I was just reading about the Improving Maternal Health Project in northern Nigeria, where you've been able to reduce maternal mortality by over 50% and repair 1,500 obstetrical fistulas. That's truly heroic. So you remind me about what Dr. Martin Luther King taught us, that human progress is neither automatic nor inevitable. Every step toward the goal of justice requires sacrifice, suffering, and struggle. The tireless exertions and the passionate concerns of dedicated individuals like yourselves. So thank you for your examples, and thank you for the honor of this opportunity to come and talk with you this morning about maternal and child health. So I guess I'm supposed to talk a little bit about myself and how I got here. So actually, I didn't have to come very far this morning, just about an hour ride on the metro on the Red Line from Rockville, where maternal and child health is located. But in a way, I came a very long way. You see, I was born in Taiwan to parents who probably would never get invited to talk at a White House event just because they never went to college. In fact, in my mom's case, she never went to high school or even junior high. You see, my mom was only 11 when her father died. And so as the oldest girl in the family, she had to drop out of 5th grade to go work in the factory to help support the family. So my parents may have never gone to college, but they taught me everything I ever needed to know about service, about caring, and about compassion by the simple eloquence of their examples. And I guess that these are the same values, the common values, that really brought us all here today. I went to medical school at UCSF, and while in medical school, I started a clinic called the Suitcase Clinic, which was a multidisciplinary clinic serving homeless and indigent people in Berkeley and the surrounding Bay Area. Although we had plenty of phone calls, people who wanted to get their suitcases fixed. Now, the reason we called a suitcase clinic was that as somewhat idealistic and maybe a little naive medical students, we thought we could just pack our suitcases with medicine and go out and provide medical care to the homeless people that we saw on the streets. Well, we found out that these homeless people often have a whole constellation of problems that took priority over seeking medical care. And if we really want to improve their health, we got to help them take care of these other problems as well. So we got others to help. We got students and faculty from social works to provide social services. We got students and faculty from the law school at Berkeley to provide legal counseling. We got students and faculty from psychology department to provide crisis intervention. We got students and faculty from the optometry school to provide vision screening and eyeglasses. We got lots of undergrad students to work as case managers, and we got local chiropractors and hairdressers to volunteer. And once we did that, every Tuesday evening when we opened our doors, there would be 50 or more homeless people waiting in line, not necessarily to get medical care, but to get their haircuts and manicures and massages. And then they found out that we also offer medical care. So that was my first lesson in outreach and my first lesson in public health. I'm happy to report that after 21 years and over tens of thousands of patients served, the suitcase clinic is still going strong. I did my residency training. I did my residency training in OBGYN and then joined the faculty at UCLA right out of residency. So I was at UCLA for about 14 years until about 3 months ago, where I taught obstetrics and gynecology at the medical school and maternal and child health at the School of Public Health. Now, my research focused on improving birth outcomes from a life course perspective, which basically says that birth outcomes are the product of not only the 9 months of pregnancy, but the entire life course of the mother leading up to the pregnancy. Okay. What that means is that if we want to improve maternal and child health in this country, we start by improving the health of girls and young women. Now, I want to call your attention to an exciting area of life course research called the fetal origins of health and disease, how the 9 months before birth can actually shape the rest of your life. There's a growing body of evidence that suggests that a whole host of chronic childhood diseases like asthma, autism, and obesity, and a whole host of chronic adult diseases like heart disease, diabetes, and cancer may actually have their origins inside the womb. Okay. For example, being born low birth weight actually being linked to greater risk for heart disease. Okay. So if I ask you, tell me some risk factors for heart disease, what would you tell me? Okay. Smoking, hypertension, okay. Diabetes, obesity, high cholesterol, low birth weight. How many of you would have told me about low birth weight? Okay. What does being born low birth weight have anything to do with your risk for heart disease 40, 50 years later on? Okay. Well, it's been shown that there are these sensitive or critical periods during development during which the function of an organ or system is being programmed. Okay. And if something goes wrong, if things don't go right with that fetal programming, then that organ or system may never function optimally over the entire life course. Okay. A simple-minded example is that if you were to get undernutrition in the second trimester, when the pancreas is rapidly growing, you end up with a smaller pancreas that may not work as well, and that may put you at greater risk for developing diabetes later on in life. Okay. So I think this whole science around the fetal origins of health and disease really elevates the work that we do in maternal and child health. If we want healthy people 2020, or we want healthy people 2050, you start by improving maternal and child health today. Okay. So 3 months ago, I moved to DC, well, Rockville to be exact, to join the federal government. Now, I don't know how many of you have actually heard of the Maternal and Child Health Bureau, but we are a bureau within the Health Resources and Services Administration, or HRSA, which is under Health and Human Services. And we're the one federal program responsible for improving the health and well-being of all children and families in our nation. We have a staff of about 160 and an annual budget of $1.2 billion, about half of which goes to the 59 states and territories in the form of the Title V Maternal and Child Health Services Block Grants, a third of which goes to our home visiting program under the Affordable Care Act, and the rest of it goes to support a variety of programs, including Healthy Start, newborn screening, autism, children with special health care needs, emergency medical services for children, breastfeeding, oral health, school health, and even anti-bullying. Now, I can go on and on. So when people ask me, are you crazy? Hey, why are you going to work for the federal government? Hey, I tell them, are you kidding? This is an opportunity of a lifetime to make a difference, to really do something about improving maternal and child health in our country. So the president has been talking a lot about giving everyone a fair shot. And if you think about it, that's what our work with the Maternal and Child Health Bureau is all about. Whether it's making sure that every baby gets a healthy start, or that every child gets quality health care, or leveling the playing field for kids with special health and education needs, our work at MCHB is all about giving every child a fair shot. But still too many children in our nation don't get their fair shot. We're the richest nation in the world, and yet we rank near the bottom among developed nations on most standard measures of maternal and child health. We now rank number 31 among industrialized nations in infant mortality. Not number 1, but number 31. And what disturbs me even more is this large, persisting, disgraceful gap in infant mortality. A black baby born today is still more than twice as likely to die within the first year of life as a white baby. You don't get a fair shot if you don't get a fair start. So how are we going to improve maternal and child health in America? How are we going to give every child a fair shot? First, I think let's start with health care, which I believe should be an American birthright. And let's start by making sure that every child has access to the health care that they need. Here, we've made significant progress under this administration in the last few years, first with the expansion of the Children's Health Insurance Program, and now with the Affordable Care Act, which put an end to the discriminatory practices by insurance plans, which is critically important for parents that are taking care of children with special health care needs. The ACA also expanded community health centers and school health centers, which will improve access for some of the most vulnerable children and families in our nation. But let me just also highlight the impact of the ACA on women's health. The ACA takes a giant step in putting the W back in MCH. Over the next few years, millions of uninsured women will get health care coverage, including coverage for clinical preventive services, which will provide an extraordinary opportunity to improve women's health, not only during pregnancy, but before pregnancy, between pregnancy, beyond pregnancy, and indeed across their entire life course. Second, let's make sure that every child has access to not just health care, but quality health care. We all know that there's plenty of room for quality improvement in the care that children and families receive in this country, and there are large and persisting quality gaps. We know that better quality can lead to better outcomes and lower costs. Just look what's happening in Ohio and Kentucky and Texas with just adoption of a few simple quality improvement measures. They've been able to reduce the number of elective inductions below 39 weeks and prevented thousands of NICU admissions and saved millions and millions of dollars. So there's a quality movement that's going on in maternal and child health, whether it's in reducing elective deliveries or improving asthma care for kids or promoting transition planning for children with special health care needs. I'm going to look for ways to support and grow this movement. Third, maternal and child health is a diverse field, but if there's one common theme that runs across maternal and child health, it's fragmentation. Maternal and child health is highly fragmented, whether we're talking about women's health or perinatal health or children's health or health system for children with special health care needs. What we need is more integration, vertical, horizontal, and longitudinal. vertical integration in terms of appropriate levels of care, horizontal integration in terms of service coordination, not only within healthcare, but across systems, schools, social services, child welfare, community programs, and longitudinal integration in terms of that continuum of care across the life course. Fourth, we're never going to give every child a fair shot by improving healthcare alone. We can have the best healthcare system in the world, and we still won't achieve health equity in maternal and child health. There are important social determinants operating across the life course that are the real drivers of health disparities in maternal and child health: education, housing, poverty, unemployment, father absence. Now, it's not our job to solve all of these social problems, but it's our job to look to partner with those who can. This means that we can't stay in our silos anymore. So at the federal level, there are other agencies whose work have just as big, if not bigger, impact on maternal and child health than the Bureau. The Bureau of Primary Health Care, the Center for Medicare and Medicaid Services, NIH, CDC. But to give every child a fair shot, we have to reach out beyond that, beyond our comfort zone. Department of Education, Department of Agriculture, HUD, EPA. The Maternal and Child Health Bureau can be the integrator, the transformer, the agent of change, and I want you to hold me accountable to that. But at the local levels, I also want to challenge you to do the same. Bring together folks working in health and education, economic development, community development, public and private sectors, professional groups, business leaders, family and community advocates across sectors, across silos, all working together, e pluribus unum, out of many, one. That's how we're going to win. That's how we're going to win this fight to get every child a fair shot. And fifth, if we're going to improve maternal and child health in our nation, we have to be making the right investments. Now, some of these investments may give us some quick returns, some early wins, but many of the investments have to be long-term and perhaps even intergenerational. So I'm going to start with the Bureau. I'm going to be looking at each and every one of our programs and asking what kinds of return on investments are we getting from all of our programs. For example, given our limited research funding, what kind of research should we be supporting that NIH and others cannot support that will help close those critical knowledge gaps and accelerate translation to MCH practice and policy? And given our limited discretionary block grant dollars, instead of trying to be everything for everybody, what are those critical investments that we need to make in order to move that proverbial needle on MCH population health? So let me close by highlighting one initiative that we're undertaking, our infant mortality initiative in the 13 southern states, and that we're hoping to scale up into a national initiative by next year. We started with these 13 southern states not only because these are the states with some of the highest infant mortality rates and some of the highest infant mortality gaps in the nation, but they're also doing some of the most innovative work around infant mortality. We brought the states together, NCH directors, state health officers, Medicaid directors, legislative staff from the governor's office and state legislatures, professional community leaders like yourself who refuse to believe that there's nothing that we can do to move the needle on infant mortality in this nation. So they worked on their state plans, and 5 common strategies emerged: reduce elective deliveries at less than 39 weeks, expanding access to interconception and preconception care, promoting smoking cessation among pregnant women, preventing sudden infant death syndrome and sudden unexplained infant deaths by promoting safe sleep, and improving perinatal regionalization. Already, states are making progress. In Louisiana, with the adoption of few hospital quality improvement measures to reduce elective deliveries, they've been able to achieve a 22% reduction in NICU admissions just in their first year. And states also express a desire to learn from each other. For example, how did North Carolina manage to build a statewide network of pregnancy medical homes, or how did Georgia manage to get its 1115 waiver to provide interconception care for high-risk women? So we're going to support collaborative collaborative learning across these states by building the COIN, Collaborative Improvement and Innovation Network, which is supported by web-based shared workspace and a data platform that will provide real-time data to drive performance improvement. We're going to start with these 13 states, but our plan is to scale up into a national initiative by next year. Our latest infant mortality rate is about 6.6 per thousand. I'd like to get us down to 6.3 in the next 3 years. I really think that we can reach and surpass our healthy people objective of 6.0 by 2020. We have the science, we have the strategies. All we need now is the political will to get it done. The president says that this country succeeds when everyone gets a fair shot. You know what? The president is right. This has always been the secret of our success. Now, we don't always succeed at it, but we never stop trying. I think this is probably what our forefathers had in mind when they made that simple declaration some 235 years ago, that we hold these truths to be self-evident, that all men are created equal, and that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. This is probably what generation of immigrants had in their mind when they set forth from distant shores looking for their one fair shot in life. And I'm sure it's what all of us had in mind when we tell our children as we tuck them in at night that when they grow up, they can be anything that they want to be. Well, America gave me and my family that fair shot. If you recall my story, I really didn't come from an educated family or a wealthy family. But that didn't matter. It didn't matter because in a fair America, you don't have to be rich to go to the best schools. And it didn't matter because in a fair America, everyone gets a fair shot, no matter where you're from or what families you're born into or the color of your skin. And it didn't matter because in a fair America that I knew that if I just study hard enough and work hard enough and try hard enough, that I can give my girls a better life, the kind of life that my mom would never even dare dream of. And that my two little girls, the granddaughters of a girl who had to drop out of 5th grade to go work in the factory, can now grow up in a nation where they can be anything they want to be, perhaps even someday the president. That's a true testament to the greatness that's America. And if my girls can get that chance, why shouldn't every child in America get the same chance? If my girls can get that fair shot, why shouldn't every child get a fair shot? So that's what our work in MCH is all about. This is the fight that we're fighting for. The Maternal and Child Health Bureau has been fighting this fight for 100 years, dating back to the establishment of the Children's Bureau back in 1912. I'm proud and humbled to be leading the Bureau in this fight now, and ask you to join me in this fight. If you believe in America's greatness, if you believe that every child should get a fair shot, join me in this fight. Let's close the gaps once and for all, and let's fight to improve maternal and child health, both here at home and around the world. Thank you very much.
Guys, so I think we have another speaker coming promptly at, Gail Smith will be here at 10:30. So let's take a break, and I think Dr. Liu has some time and is going to hang out with us. Just outside, we've got coffee and pastries set up just outside here. But we'll just need to be back in here by 10:30, but Dr. Liu will be around if you want to approach him for questions.